Karen. This is Brianna Richmond, and this is my video on a CVC dressing change. So the first thing I am going to do is verify that my physician's orders and make sure that the CVC dressing is in fact due to be changed. I'm also going to verify the patient by checking the wristband, doing all my checks. And then the next thing I'm going to do when I come in is explain the procedure to the patient so that way it kind of relieves any anxiety that's going on. After that, I will take a look around the site and I'll make sure that there's no phlebitis or redness, any pain that might be occurring. Once that is all said and done, I would start my dressing change. See, everything looks good. So I will, see, this is the port. I would pull my tegaderm away from going in a circular motion towards the port, just slightly loosen it up a little bit before I actually put on the gloves. Once that's done, I would put on clean gloves. And I would pull the rest of the tegaderm and the gauze off. I would look at it, I would make sure if there's any drainage, and if there is, the type, amount, color, and odor, and then I would discard of this. I would also access the site, or the insertion site, and make sure that there's no drainage, but if there is, also note the type, amount, and color and odor of it as well. So our site looks good, our sutures look in place, there's no redness, patient complains of no pain. So I will get started on the dressing change. I want to open up all my supplies with Sterile Technique the best that I can. And I also want to make sure that I do not turn away from the site for my supplies once they're open. Okay, once the actual supplies are done, I will go ahead and put on sterile gloves and start cleaning and changing the dressing. Also, when I'm in there, I want to look on the tape piece and make sure that the time and date is in fact like today's date, and it is ready to be changed as well. So, I'm going to shift it over a little bit so I can see. And then I can adjust this. To have these sterile gloves on, I want to make sure that I do not go below the waist. Okay. So I have my sterile gloves on. Next thing I'm going to do is I'm going to get my ChloraPlep ready, and I'm going to clean the site. So once I grab the ChloraPlep, I want to make sure that I activate it by squeezing it. But I do not want to do this towards my supplies or towards my patient or towards me. So I'll just simply activate it. This cleans in a, or activates the cleaning agent by friction. So I will just go back and forth in a box motion around the site. This way, here. Good. Okay. Next thing I'm going to do is I can contaminate my pinky. By doing that, I can lift up the lumens and make sure I'm getting good underneath the site or underneath the port as well, and around the suture. So I would just lift it up. Now with friction under there as well, and then now my pinky is contaminated, and I would dispose of this. So that's good. I'm good to put my gauze. Take my 2x2 and I would put it over the insertion site. And then when that is done, get my Tegaderm. Make sure I do not touch my pinky. Then I would lay the crease over where the sutures and the port is. And I would just simply lay it down. And push down on it. Okay. Once this is done, I'm good. I no longer have to wear the sterile gloves. And then I would pull off the piece of tape that is on the Tegaderm. One side. Just maybe. There it goes. Place it on here and I would date, time, and initial it. Once that's good, just ask the patient if he's good, if he's feeling any pain. If he has any other questions, then I would actually chart if there was any drainage, was there anything abnormal about it, or if there was any pain experienced with it. And then once that's done, it's all good. And then that is your CVC dressing change.